welcome back to my YouTube channel. Again, it's me, Alona, and today I have another interesting topic that I want to talk about. I want to talk about different types of nipples. I have some requests in this on talking about the different types of nipples. So, if you are pregnant right now or planning to get pregnant and you have concern that you have your nipple is large, your nipple is too short, too long, inverted, dimpled, what else? Flat. So today is the day we're in. I'm going to show you some technique on how you can fix inverted, flat, large nipples that could not put pressure on you and the baby. Okay? So if you are expecting right now and you're worried that you have a flat or inverted nipple, what I want you to do it really gently, okay? Let's say your nipple is like that, maybe flat or inverted. Every time if you're taking a shower, taking a bath, or even if you're in bed, you can hold your nipple, the middle of it, even if you're flat or inverted, hold the middle of it and move it side to side. Do that one maybe 10 times, about 2 minutes, every day when you're pregnant or even before the baby. If you have a baby right now and you're struggling with flat nipple, inverted nipple, it's not too late. You can still do a nipple, they call it elasticity massage or exercise of your nipple, because our skin, our nipple is elastic. So you can pull gentle, pull side, side, pull side, side. So that's how you're gonna prepare yourself. Now, what you're gonna do with an inverted nipple. If you're struggling with the feeding, some women would use nipple shield. Nipple shield is a silicone that you put it on top of your nipple and it's shaped like a nipple. Now be very careful. I'm going to talk more about nipple shield because there's so much mistakes that mom choose with nipple shield. The nipple should be right at the middle of that shield, because if you don't put it really centered, it can crack or damage your nipple. Okay? Now going back to inverted nipple, most of inverted women with inverted nipple will get poor latch and poor milk supply because the baby cannot really suck fully and stimulate the breast. When there is lack of breast stimulation, there's low milk supply. So what you can do is making sure when you latch inverted nipple, you need to hold your breast. You can even use a pinch hold. I call it pinch hold because you really need to get the full breast tissue around your nipple so that when you latch the baby can fully latch deeper. So you hold it this way or you can hold it this way. It's like a pinch hold. But remember, when you put your thumb, put it on top of the areola, not this. Because when you do that, there is no room for the baby's mouth to cup your nipple because you're overcrowding with your fingers. So I want you to put your thumb right on top and do like a pinch, or imagine yourself eating a burger. How are you going to eat a burger? When you eat a burger, you do this. That's the hold that I want you to do when you have inverted or flat nipple. You really need to get full skin. Now, this is most mistakes mom would do. When they latch a baby using this hold, Once the baby's in there, they release it. Don't. Keep holding on it. Keep holding your breast tissue until you can feel a good pull or suction. Wait maybe 2 minutes, holding it. Once the baby's in there, then you can release your hold. Because if you hold it too soon, guess what? The baby's mouth will just slide away from your breast, especially if you have a large breast, because the weight of your breast tissue, the baby can hang onto it. So make sure you keep holding it like you're holding a burger. Hold it until the baby is latched properly. It's called a sandwich, a burger hold, whatever. Now, for large nipple, I've encountered so many large nipples in my nursing career. And to be honest, most women, again, in Asia, in my experience, have that problem of large nipple. How are you gonna latch with a large nipple? First, you have to start with the side. You can latch it sideways, because when you latch the baby directly right to the middle with your nipple, guess what happened? Your baby gonna gag because your nipple is just too big when you go in. Sorry, there's a distraction. So I want you to latch. You can start from the side and go in. So making sure the best way to latch this one is when you're laying back, because when you lay back, the baby's mouth is really gonna be wide open and the baby won't gag. Okay, so that's the problem with large nipple. Now I did inverted, I did the flat. Now for inverted nipple, yes, moms, if there's no more way that nipple will protrude and you struggle with latch, one resort would be to use a nipple shield. However, if you're using a nipple shield, make sure ask for your healthcare provider to assist you with that, because the nipple shield has different sizes and some women will get the wrong size. And if you're using the nipple shield, make sure your baby's weight gonna be checked, because you don't know if the baby is really getting lots amount of milk with the nipple shield on until you weigh the baby. So if you have a weighing scale at home, which is most women don't have a weighing scale at home. Normally in my clinic, if the mom is using nipple shield, I weigh the baby first. Then I weigh the baby after a feeding with the nipple shield on, because I want to know how much the baby is getting. Okay, if the baby is getting 20 mils, that's good. 30 mils, that's good after a feeding. Now for small nipple, it's really how you're holding your breast. Okay, if you do a C hold when latching, that's a good position to latch a small nipple. The long nipple can also cause gagging for babies, so you can also do sideways just like the large. Okay, the dimple, I don't know if you heard about dimpled nipple. Dimpled nipple is almost close to inverted, but not fully deep. Okay, so the same way when you do the C hold or the pinch hold, that's the best way to latch a baby. Well, I think I've mentioned all the types of nipple. However, even if you have a long or large nipple right now, or an inverted nipple, what really is the trick so that you won't struggle with latching is breast preparation. When your breast is very, very hard, it's so hard to do a pinch or a C hold when your breast is really, really hard. So make sure, massage it first. You can express some first if you want, so that you will be able to fully hold it perfectly so that the baby would latch. You cannot expect a baby to latch properly and you have an inverted nipple when your breast is totally full, because it's gonna be so hard for the baby's mouth to stay in there while latching. So consider your breast, and also consider on how the baby would struggle with the things that I had just mentioned. Well, thanks for watching, and please subscribe. I'm hoping I'll see you again in my other coming more videos, and have a nice day.